Namaste, welcome back to our channel. My dear student, today's session I am going to discuss about the first stage of labor and its management. My dear student, last session I have discussed about what is the meaning of labor, what are the stages of labor. And today's session I am going to discuss about what is the first stage of labor. Under that, being a medical practitioner, being a nurse, so what is the first stage of labor? It's management. So let us see what is the meaning of first stage labor. I have explained about what is the meaning of first labor. That is nothing but it is starting with true labor pain. It's end with complete dilatation of the cervix. As I told you, so the delivery process, the first stage of the delivery process, it will take the time duration if it is primary gravida. In the sense, if it is the first delivery mother, that will take the time 12 hours. Whereas the 6 hours time duration will be taken for the multipara. So the differentiation between the primary gravida and multipara. So when the mother is going to the first delivery, so the anatomically, physiologically, all the reproductive system will be the consistent. Whereas, so the time taken will be the increase. So coming for the multipara, so once the delivery of the mother, more than 2 babies or 1 baby, the anatomically, physiologically, the process will be little bit good. That's what the muscle contraction, relaxation will be the happen nicely. So that is the differentiation between. So here we can see the 12 hours will be taken for the primary gravida. So what we need to help to the mother being this 12 hours. So what mother supposed to do for the first stage of labor. So in that case, the aims of the first stage of labor, the first one is to maintain the normal labor. Absolutely, as being a medical practitioner, we must focus while the mother is in the first stage must be conduct normal natural delivery. Whereas what is the purpose? The first one is so conduct the safe and clean delivery. Absolutely, when we are going to conduct the delivery process, it must be the sterile technique. Yes, and clean also. And also, we must focus on prevention of exhaustion, injuries and bleeding of the mother as well as baby also. Always we must focus on those things. We must focus on to prevention of maternal fetal distress. So that is absolute our purpose. And what are the principles? So principle is the first one is to conduct the natural birth. Yes, and next one is monitoring of the carefully MCH services. In the sense, maternal and childhood services, we must ensure whether it is going smoothly or not. And what is a preliminary assessment? So before conducting of delivery, within the first stage of labor, as a nurse, we must focus on this. The first one is history collection. The second one is assessment. In the sense, examination. Most probably, we must go for obstetrical examination, include vaginal examination. So vaginal examination is the very important in order to find out of the rupture of the membranes. If the rupture is happened, we can able to find out the discharges. Whereas for that purpose only, we need to go for vaginal examination. And next one is some recording of review. So past medical history, past obstetrical history, past medical history, everything we must go for review before going to the delivery. And that is a preliminary assessment. And what is the actual management for the first stage of the labor? So actual management, in that the few things are there: support to care, a position and mobility, rest and ambulation, nutrition and bladder and bowel care, and prevention of infection and relieve the pain and observation. So these are the things is belongs to the actual management. One by one we'll see. The support to care, where the management, where the first stage of the management we can able to find out the support to care is a very important in the prevention of anxiety and depression for the mother. Before going to the mother for the labor room, the mother is having such a so much of depression and anxiety feeling. In such case, so being the staff or being the person, medical person, we must communicate with the mother nicely to prevention of anxiety and everything, and ensure the privacy and confidentiality. So this is a very important for the support to care. And next one is positioning and mobility. So in order to maintaining of good contraction relaxation of the uterine muscle, we must ensure good positioning and mobility of the mother. So during the 12 hours of the first stage of labor, So we must ensure this kind of the position as you are seeing in the pictures, in order to prevention of the some kind of the pressure, that is a mobility. And next one is rest and ambulation. So rest and ambulation is nothing but, in some cases the mother may go for rest, in some cases the mother need to go for ambulation also. So ambulation is nothing but somewhat mobility. So when there is a mobility, so in such case we can prevent the vena cava pressure. Yes, so that is one of the supportive therapy. And next one is a nutrition. Maximum we must prefer the nutrition like water, salty water and soups and fruit juice. So liquid diet only we must focus for the nutrition for the mother before the delivery. Especially, so RL is a thing we must administer IV fluid before the delivery to prevent the dehydration for the mother. And next one is a bladder care. So emptying of the bladder every 1 to 2 hours. So that is the bladder care we must encourage. And next thing, catheterization will be strictly aseptic method. So that is a sterile technique we must do. And next one is a bowel elimination. So bowel elimination will be done before the sending of labor. In that case, that is called as bowel elimination. And next one is prevention of infection. So whenever you are touching the mother, so whenever you are going to do a delivery process or whatever it may be, make sure that your hands are hygiene or not. In that case, you need to go for medical or surgical hand washing as we are showing in the picture. And next one is relieving of the pain. So in order to relieve the pain, don't administer any kind of the anesthetic. You just go for suggest the changing of the position. By that, the pain will be relaxed somewhat. And observation. So observation is a very important to prevention of distress and anxiety of the mother. So you must observe the patient vital signs as well as mother and baby vitals also. So urine analysis of the urine is a very important kind you must do before the delivery. And next one is abdominal examination. As I told you, so abdominal examination, especially vaginal examination, we must focus before the delivery. And as well as not only for the mother, but also we need to assess the fetal condition of the mother also. Actually, the fetal heart rate normal is 110 to 160 per minute. That is actual normal. So here during the latent phase, we have 3 kinds of the phases here. So during the latent phase, every 1 hour you must go for fetal heart rate checkup. During the active phase, every 30 minutes you can go for check. During the second stage, every 5 minutes you can go for assessment of the fetal heart rate. You must understand one point: when the fetal heart rate is less than 100 and more than 180, it seems that the baby in the distress, the baby is somewhat difficulty. That is the thing. And reassessment of the fetal heart rate, when you need to go for reassessment. So when the rupture of the membranes, you just go for fetal heart rate. Vaginal examination, ambulation, whatever the things are there here, everything you must go for reassessment of fetal heart rate. And next one is progression of labor. What is the progression of labor? So during the first stage of labor, every vital signs or rupture of the membrane or cervical dilatation or descending of the baby, so overlapping of the baby, everything you're going to note, that is called as partograph, the graphical representation of the labor progression in the particular thing, that is called as partograph. So that's about today's session. My dear student, today I have discussed about the important topic belongs to the obstetrical gynecology midwifery of the nursing subject. So I have discussed about what is the meaning of first stage of labor and what is the management for the first stage of labor as being a medical nurse practitioner. That's about today's session. I will come with next session soon. So until that, stay tuned. Thank you so much, my